Good morning. I'm going to give folks just a second to turn your cameras on, which would signify agreement to participating in today's session, which is recorded. So once I see more faces pop up, we'll go ahead and get started. Awesome. All right. Well, hello, everybody. Thanks for being here today on Monday, December 8th. My name is Stephanie Kucher. I'm the Quality Improvement Coordinator at Stark-Mar. So I'll be kicking things off today. And just a reminder for folks, we are not able to accept any AI like note takers in our meetings. So if we do see them in our lobby, they will be removed. So just a heads up for folks. Thanks, Stanley. Appreciate the heads up. So I know this is a smaller group than normal, and we're going to go over our normal review process of changes from last year to this year, but we were talking as a group before we all signed on to just see, because this is a smaller group, did anybody come here to ask a specific question off the bat? So we can maybe start with that piece if you want to just unmute and start with your question. And if not, that's okay too.
I have a quick question.
Yeah.
So my name's Alexander. I work for a treatment center called New Destiny.
Mm-hmm.
We're right outside of Stark County, which is why I'm kind of surprised that you guys invited me to this, but I'm grateful that you did. So about 30% of our clients are from Stark County, and some of them want to return. So I've had a hard time trying to find them support, transitioning them back to Stark County. That's why I was trying to get onto a Stark provider list. But being from another county, is this possible, or am I still just kind of dreaming too big?
Well, thank you for being here. I think it was our understanding that you wanted to be added to this list. So if it was to be connected for a different reason, that's okay too, and we can talk more about that at another time. So this is regarding our annual allocation process. And unfortunately, we're only able to fund those who have a brick and mortar location within Stark County. So it sounds like maybe we can have some other discussions about how we can maybe work together. I don't know if other folks from Stark-Mar on the call have other thoughts around this. Seeing head shakes. Okay. All right. Well, Alexander, we can circle back. I know who connected you with us, and maybe we can see how we can best work with you all at New Destiny.
Thank you, Stephanie.
Yeah, absolutely.
Stephanie, I had a question real quick.
Yeah.
So I have a question. This is my first time doing the RFPs in this model, and I just had some specific questions about what I need to do specifically in this. So would it be okay just to email the RFP question email still, and then to get deep into it in here? There's not a lot of people that are doing residential that are on the call with me.
Eric, that's an option if you'd like.
Okay.
If we get to a part of the form that applies to your question, feel free to jump in and ask.
Okay. Great.
Either way. Yeah.
Great. Thank you. Yeah, I'll just wait. I'll email you and I'll follow along with something if you get to something that I need to know.
Okay.
Or fit in.
Yeah. So. Sounds good.
Thank you.
Yeah, you're welcome. Did anybody else join with like a burning question right off the bat today? Head shakes? No. Okay. Well, we just wanted to make sure that we had time for that, which we probably will, but just wanted to check in with you all. But okay, we can go ahead and do our normal kind of spiel today, and feel free to ask questions along the way today. So again, this is a recorded session, so it'll be uploaded onto our YouTube channel, and a link to our channel is on our website. If you're not searching YouTube, you can get to it that way. Now that the RFP has been released, questions can be asked today in this session or in the email address that Eric referenced. And so that is rfpquestions@starkmar.org. You should see that email address in a couple different documents. So if you send a question to the RFP questions email, you should receive a response from us within 24 hours. And all questions and our answers through the email, through our Q&A sessions like today, including chat, will be transcribed and made available to view on our website. And that's because this is a competitive process. So we want to be transparent with our responses to questions that come in. So this session will only share updates on our forms from last year to this year. So if you missed our first Q&A session, which it walked through every form and it outlined updates from last year to this year, you can view that and the previous session on our YouTube channel. So the second Q&A session we had was just like this one, where we went over updates to our forms from last year to this year. So if you have either not been emailed the RFP documents or you can't find the email from our RFP release, you can pull up our documents from our website, and that's www.starkmar.org. And right on the homepage is a green button that says SFY for state fiscal year 27 RFP. So that's the same place you can go to access the link to the recorded Q&A sessions, as well as the transcribed questions and answers that have come up in this process and that will come up in this process. So that is all for my introductory spiel. I'll go ahead and dive into the documents that had any changes from last year to this year, and we'll highlight those big and small just to be transparent with you all. So I'll be sharing my screen on and off as I go through this. So bear with me as I pull up each form. I'm going to hit share and pull up our face sheet, checklist, and guidelines document. And it is on one of my side monitors. So if I'm talking and looking to the side, that's I'm looking at the form. So every form should start on the first page. You will see this is a small change, but we added a table of contents from last year. And it mimics the guidance document, if you remember the table of contents in there. And anything that is blue is a link to a section within the document. So if you just want to jump to something specific, you can hit the Control key and then click. That should take you there. So I'm just hoping to make it a little easier for you. I'm going to scroll down to our actual face sheet. There were no changes to this section or this page this year, so I will keep scrolling. And here is our checklist. So if you are submitting a proposal to us, this is a good reference for you. It also is a document that we want you to complete and submit to us. So you will see different program types. So we have all programs, consultation and prevention, government entities, recovery support and treatment. And depending on what type of program you are submitting, these different sections will apply to you. And so it is a checklist. You just go ahead and check the boxes as you're including those pieces. But the change that was added that I wanted to highlight, we just added our proposals at starkmar.org email address here so you know where to submit the form, and we actually included that on all of our forms, just to make it super clear, especially if you haven't worked with us before, on where to submit your RFP packet. And at the very bottom of this sheet here in the pink, you will see something called expedited RFP. And if you've worked with us before, that was previously named the waiver. We used to call the expedited RFP the waiver, which means you meet certain criteria to skip a lot of the required documents on this page. The criteria is later in this document if you're interested, and those who met criteria were already notified for qualifying for the expedited, but that is a change in case you're like, what is that term? That used to be the waiver. So that's the only change on this page. Or the last change, sorry. We did remove language throughout this very document of a shortened RFP versus a full RFP. There used to be two different versions. A full version was specific for treatment programs, and a shortened version was for consultation, prevention, and recovery support, just because we asked for less information from the non-treatment folks. But we worked on our RFP process and documents as part of our strategic planning process and made some changes to both the processes and forms. And as a result, we just have one version of the RFP for everybody to fill out in hopes that it's less confusing. And the same goes for the personnel cost schedule, which we'll walk through later on. There used to be a full and shortened version of that, and that was referenced throughout this document. There is just one of those. So that is something else that you'll observe as a change if you've worked with us before. So I'm going to scroll down again. Here is a page on accreditations and certifications. And one change is that we expanded this bulleted section with more information on non-Department of Behavioral Health certified providers who would like to work with us. So we added more guidance around partnering with an already certified entity to be included in the RFP for us here at Stark-Mar. So we added some more guidance around that with both providers being in agreement. You'll see here the certification for the certified provider, and that working relationship must cover the services to be provided by the one without the certification. And the RFP must come from the certified provider. And then Stark-Mar must be informed of the partnership. So if the partnership was established even after RFP release, I know we can't have conversations around that after release. We can be informed via that RFP questions email address. So we just expanded on that in case anyone wanted to partner with another entity that may not have certification through DBH. And then the other change is way at the bottom. So I'm going to just quickly scroll. So look away if that makes you kind of woozy. So here's the expedited information on the last page. Sorry, guys. I'm trying to find that one. Here we go. The last change in this document is this just small paragraph here that at the end of the fiscal year, we will still require program actuals being submitted for all Stark-Mar funded programs. So that's just like in the past. But when Chris walks through the budget, you will see a big change from last year to this year. So as a result of working with that change, we have included here that providers may use a P&L by program or any internal format that you prefer. So we can also provide a template if requested. So that is something different to work with the change that was applied to the budget. And I think that's all the changes for this face sheet document. Let's stop sharing so we can all see each other. Are there any questions on that specific document? The next one I want to pull up is our guidance document. So I will share. All right, and I'm actually going to use our table of contents to jump to the first part that has been updated. So that is permanent supportive housing. And so this section specifically was updated this year. So if you're interested in providing PSH services, take a look at this section. I'm going to scroll to our next change, which is around drop-in services. Here we go. So it is expected that if you are interested in providing drop-in services and that being funded by Stark-Mar, those services will be staffed by a certified peer supporter or supporters and will include support and or education group curriculum as part of the service delivery model. So we just wanted to be transparent with our expectation around those specific services. Next, I'm going to scroll to early childhood mental health. Bear with me. Here we go. This last part of the paragraph, we did add, again, for transparency, that funding should not exceed 5 consecutive years. And we have our why behind that. And so if you're interested in applying for funding for ECMH, we have that in there for your knowledge. Next, I'm going to scroll to our outcomes section. All right, so this starts off by program type, and I just want to say kind of a blanket statement to folks out there to please double check outcomes listed here. We listed every currently funded program and their outcomes for fiscal year 27. We did make some tweaks to some of the outcomes, so I'm not going to go through every single program. So if you have somebody on your end who maybe works with the reports who's not on the call, make sure that they see this document and look at the outcomes that are expected for next fiscal year. And if you're that person, that's great. Please make sure to read over the outcomes that are expected. And if you are a newer provider or are submitting for a program that's not listed, we can touch base later on about what the outcome should look like for SFY27. And one more change I want to outline here. Bear with me, I'm going to scroll a lot to our scoring section. Here we go. This is much shorter than previous years. We really expanded in the past around this, more so around the shortened and full version and minimum thresholds and priority areas. So once we went through our strategic planning process, we really cleaned up some of the processes, like I mentioned earlier, and therefore the language in here has been shored up to reflect current scoring methodology. So that's another area that has changed from last year to this year. And that is it for our guidance document. So I'll pause here and see if there's any questions. Moving along. So next is one of our curriculum evaluation documents. Let me pull this up. Okay. So I have up here the curriculum evaluation form for education groups and classes. The change that I just want to outline, it's just one. It applies to this set of groups and classes, treatment classes and groups, as well as prevention. So it does not include support groups, but it's towards the middle, and it's just one extra yes/no question is if you submitted a curriculum evaluation for this group or class last year, has the manualized curriculum changed from the previous year, yes or no? To the best of your knowledge. And that'll help us as we review internally, because we do check all the sources of the classes and groups that come in this way. So this will really help us make this internal review process more efficient. And hopefully it'll help you review it on your end too to see if there's any differences. So that's the only change for the curriculum eval form. Any questions on that one? The last form that I will go over is our actual RFP template. That's the main document. I will share my screen. It's going to open to the instructions tab. That's how they all have been saved. So bear with me as I open it. It's a lot of words at first when you open it. But all right. And just a tidbit before we dive into this document, actually. So we had a pre-RFP release preview of this exact document on October 22nd of this year. And we presented this updated narrative and budget form since it looks so different from past years. So yes, we had our normal Q&A sessions, but we wanted to do a little pre-release viewing of it for folks to digest the information in the new format. It was recorded, but we chose not to post it because there were still some updates after that pre-release preview to this exact document. So we didn't want to cause any confusion by posting a presentation that showed a form that looks different than what you're looking at today. So if you went to the pre-release preview and are wondering about that, that's kind of what happened. But we will walk through this form here today, so don't worry. And this will definitely be available to view after we're done today. So, and we tend to get those up within a week of the Q&A sessions. So we did add this initial paragraph here, and really, I won't read it to you, but it really reiterates the why behind the change in the format from last year to this year. Again, summarizing some of the work done in our strategic planning process that led to these changes. We did add a reminder here in this next row of encouraging fiscal staff and program staff to spend time and work on these proposals together. Assuring alignment between the narrative and budget sections, which we will look at next, and that they tend to do better in the scoring process if they are cohesive and aligned between the two sections. And on that same line, we did add, this is straight from the guidance document that we looked at, a bulleted list as a reminder of proposals that tend to do well on scoring. So just some reminders of what to keep in mind as you're developing your RFP. And we do have a reference to another tab called Sample RFP Form, so you'll see that right here for just example responses to questions that we have in our template. I think there is one more change. Yep. on this instructions tab, and it'll stop you because it's pretty and bright and colorful. So it's a note if you're interested in providing outpatient services. So the way Stark-Mar categorizes outpatient services is either intensive or non-intensive. And what we have here is the explanation of each. So the difference between the two is the addition of CPST services. So in order for a program to be considered intensive in our eyes, CPST services are to be made available. So that's what would flip that program name to intensive. So intensive outpatient, if a client has an AOD diagnosis, is also considered intensive. And then you'll see a visual here for any fellow visual learners, a spectrum of services here that would be available in outpatient services. So you'll see peer support, counseling, MedSum, and CPST, and then where we would consider non-intensive, and then the full intensive services program. So for anyone who is not familiar with that, we wanted to put that in there just as a reminder if you are interested in providing outpatient services. I'm going to flip to the middle tab, which is our actual RFP form, and it's going to be pretty small, and that's intentional. I want to start off by showing you all how the narrative is next to the budget section, and then we'll zoom in and walk through. So it's small, but so you'll see columns essentially A through J here, and it goes down further than what's in view. That's our narrative section. So that's really where you sum up your program. And then K through T is where the budget lives. And they are side by side. And again, in hopes that program staff are aware of the costs within the program, and then fiscal folks are aware of what's being provided in the program from the clinical or program side. So I will go ahead and zoom in just on the narrative piece, and Chris will walk through the budget after me. So maybe one more. All right. So again, I'm just going to highlight the changes from last year to this year. So if you want a full walkthrough of this form, you can go ahead and pull up our first Q&A session that's recorded and up on our YouTube channel. So this narrative side is really long, and we wanted to make sure, excuse me, that if you wanted to print your RFP, this form, that the budget and narrative should be visible, like all the columns on one page. So that's why the narrative tends to be a little longer in this version, because that is our hope if you need to print this out. Okay, so for folks who are used to our previous form, we did remove some questions in our strategic planning process. So we removed the length of stay question. There was a demographic question, a geographic area question, and then the max number of people who can be served at any time. So those were removed. Yay, less questions. I will scroll down. And actually, because there's new folks, I do want to point out, so you would, if you're interested in the outpatient piece, like we talked about in the instructions tab, sorry. And let's say it's for adults, we do have adult non-intensive and adult intensive as drop downs. So again, think about the services being provided. If you are offering CPST in an outpatient setting, you would select adult inpatient. And then there is non-intensive. The same goes for youth as well, if you're interested. So just wanted to clarify that. We did add a question just for treatment providers on the average wait time between the initial assessment and then the first appointment. So it's a drop down. You can select not applicable if this is not a treatment program and then move on. So that is okay. We do have time frames here. Select the one that best represents your program. And then everybody, we would want the wait time to begin services in the program. So there's a drop down there as well. So that is one new question that aligns with our provider dashboard if you're currently working with us. I think that's it for this top section. So I'm going to scroll down. Okay. If you remember last year's template, question 6 was a big open text box, and that's really where you put like the meat and potatoes, describing your program, telling us what it entails, and it was just a big open text box. Now, in the previous year's instructions tab, we did have a breakout of elements that we were interested in seeing within that big text box. This time around, we made those breakouts from the previous instructions tab their own questions in this template. And the reason, there's a couple of reasons, because we want to be clear to you with the information that we need on our end. We hope that it'll lead to more succinct responses from your end. You don't have to write a giant book within a question like you did previous years. And we're hoping it gives us the information we need to make decisions around the program. So this part is expanded and might look like a ton more questions than last year, but it's really what we had looked for. And instead of just keeping everything within the instructions tab, we brought it to the actual form so that we can just be clear on what we're looking for when you're describing your program. So you will see an essential elements header here asking for what specific services will be provided and what types of staff are involved in the service delivery. For the specific services, it really should align with the section in the budget that's looking at like the actual codes that you are providing. So those should really align. Comparative advantages, these might be some familiar terms to you if you saw our last template, last year's template, excuse me. So what sets the program apart from others? What is innovative about your program? And then we have delivery strategies where the responses may be lengthier. So we provided extra space for you. Yeah, Hillary, go ahead.
Hi, Stephanie. I had two questions just in thinking about this for adult mobile. So the first question was up in the section 3 with the age range. It says adults 18 and over. But with MRSS, we would constitute that 21 years and older. Does it matter that I check adult 18 plus, or because there's no area for me to type an explanation?
I think 18 plus is okay.
Okay.
Thanks for that catch. If you feel inclined to include it in maybe one of the narrative sections that have the open box, you're welcome to.
Okay.
Yeah,
perfect.
Good catch. Thank you.
And then under number 4, the wait time question. Adult. So we don't have a time between initial assessment and first appointment.
Sure.
But when I select not applicable, it says not a treatment program. It is a treatment program.
Right,
yeah.
Right.
Is that okay? Okay.
I mean, someone jump in if I'm misspeaking, please, from Starkmar, but I know we're familiar enough with adult mobile to know the responses. I mean, I think you can even select within 10 working days and we'll know that obviously that you're going to be quicker than that.
Okay.
It's really hard to make one template fit all of our programs. So,
Totally get it. Totally get it. I just don't want to, I don't want to answer it wrong. You know what I mean? So I just was
yeah,
asking. Yeah.
yeah. No, we appreciate
Okay.
that. All right, Natalie, go ahead.
Hi, is there a character limit for the other narrative questions? I know the first one had a character limit, just the general program description, but the other narratives, is there a character limit? No?
No,
Okay.
no.
All right, thanks.
Yeah, you're welcome. And the reason there's a character limit on that initial, like, describe your program is folks have tended to really mirror that question 6 from previous years, and it became kind of duplicative and a lot of work, I think, on providers' ends, where we're just looking for a snapshot. And that specific question, I guess I can have it in view here while I'm talking about it. We use that not only like for new staff if they're interested in understanding the program, but this information also goes to our board members so that when they review our recommendations, they understand the program just in a quick little nutshell. So that's why we wanted to limit it. It got quite lengthy and we really didn't need that much information. But great question, Natalie. None of the others have a character limit. All right, good questions. All right, we are on delivery strategies. So this is longer and you don't have to fill the whole space, but we wanted to provide enough character space in case you needed it. But we do ask how customers are engaged in the program. And so you can go ahead and take this section to describe that process, how they flow through the program, and any special strategies that may motivate the customer or client to meet their goals, work towards program completion. So those really have been, again, those expanded areas in previous years' instructions tab that we brought over this time around, just for additional clarity on what we're looking for. All right. We did remove another area two areas that were removed. You may remember kind of getting towards this part of the narrative. There was a locations of services question. So we did remove that piece. And then we removed an area probably towards the beginning that I skipped, I apologize, of priority area numbers and then the percent of the budget, if you remember that. So that was another area that was removed. I'm going to go ahead and scroll to our outcome statement section. So if you were at that pre-release preview, this is a section that has changed. So it's split into essentially two sections. So it says for programs not required to submit data into the OBIS system, which is typically for treatment programs, you would check the box to signify agreement with the outcomes from that guidance document that we walked through. Remember, look at those outcome statements that are expected of your program. So we have here applicable programs include consultation and prevention, recovery support, and then real specific programs that could be considered that fall under treatment, but have their own outcomes for various reasons. So if you are in agreement with what's in the guidance doc, you can hit this checkbox. For treatment programs that are required to submit data into OBIS, you can propose percentages for each outcome statement. This is what is in OBIS, and then you can go ahead and just type in, I'm just typing in random numbers, your percentages here to the applicable outcome statements for your program. So this mirrors previous years. If your program is not described up here, then this section applies to you. So that has changed since, again, that that preview. And the reason is because we need to have a baseline of these OBIS outcomes before removing them from this question, which is what we initially proposed. So just to clarify that for you all. And then evidence-based practice models. This is an open text box. Well, each row is open for you to just free type. This section used to have a bunch of checkboxes with lots of different evidence-based practices for you to check. We know things change, and so we're leaving it up to you to type in what applies to the program here. We also have that supplementary document that's a PDF that outlines Starkmar supported evidence-based practices and models. And so that'll be a good reference for you as you fill out this section, as you look at which models are provided within your program. And that document got quite lengthy, which is great, but that would be a lot of checkboxes on this template. And so for it to be a little more clean for you all, we made this change so that you can just type in the models that apply to your program. I have one more section to share before I pass it over to Chris. And it lives under the budget section. So I'm just going to scroll up to it. So you'll see here, this only applies to adult residential, crisis stabilization unit, and detox programs only. So if you don't provide that, just leave it blank. That's okay. So we are asking for the proposed utilization rate for the program in this section here to the right. So if you are proposing for CSU and detox, you can go ahead and type in your proposed utilization rate. If you are sending in an RFP for adult residential, we do ask that the proposed utilization rate is split out between men and women's beds. And again, you can leave it blank if it doesn't apply to you. We made some changes that Chris will walk through that leave us not knowing or having an idea of the utilization rate. So we added this in hopes that it'll just be a quick and simple way to understand that proposed utilization for your program. And I shared this in the last Q&A session, but especially folks who have worked with us before, please feel free to share with me any feedback on this new updated form. We're interested in your feedback. We've made changes before because of provider feedback. So we're curious how this works for you, how it flows as you complete it. That's it on my end, Starkmar folks. Did I miss anything on what I shared, or is there anything else to cover? Seeing head shakes. I know I gave Chris not a lot of time this morning. I apologize, Chris.
That's all right. I don't think I need a lot of time because there weren't.
Okay.
There were big changes to the budget section, but it's mostly just taking things away that were kind of troublesome for folks. So obviously, I'm still open to any questions y'all have about it, but I'm going to mostly just highlight what we essentially removed. So I'm going to share my screen now. Make sure I grab the right one. And I'm actually using that sample RFP form tab because I'm a numbers person, and when I see blank spaces, I kind of glaze right over them. So I kind of need those numbers there as my little safety blanket to get me through this. So I'll cover the budget section of this, and then I'll also touch on the personnel cost form. And as I said, I think for both of those forms, most of it is us just kind of taking away things that led to like more intricacy and filling it out. And hopefully folks will find this has just simplified everything. The biggest change, well, I shouldn't say the biggest, one of the large changes on this form is we no longer have the sections for budget and actual and then calculating a variance. And that kind of throws back to what Stephanie mentioned earlier about us getting that program budget versus actual information. It was pretty cumbersome to include this form. It was confusing that it was in the application form. Most folks have their own internal documents where they're doing budget actuals on their programming or inside of their own financials, and then they're having to translate it back to the RFP form. So we decided to remove it from this form, so this form could focus just on the budget portion of the application. That being said, in this budget section, nothing is changing in these categories. We're still doing the direct costs, salaries and fringes, and then indirect costs, salaries, fringes, all of the other lines. The biggest change that we made here is in the revenue section. And if you recall from past RFPs, or if you're new, we used to have Starkmar funding, and I think maybe we seeded it with Medicaid reimbursement, but then we left all the other funding pots blank and let folks kind of key in. And we were kind of getting different results from people, as we probably should, because we weren't being very specific. So we've now become more specific here and said, hey, here are the biggest categories that we care about. And here's an other, if you need, if you get some other money from some other private foundation or other source that is not described in the ones above. That's mostly the same. It's just we're a little more prescriptive in the information we're asking for. The change here is in the Starkmar funding. Returning folks will remember this. If you're brand new, just be happy you didn't have to make the math work. We used to have it go down and reference a bunch of cells and then pull that total up. And some of those cells were unit based, and then you had to estimate the number of units, and it was kind of a complex way to build the budget. So now this is just an open box where you fill in the amount of funding that you're requesting from Starkmar. And that's it, plain and simple. If you need 175,000, you key it in. In this case, they're saying we need $32,000 in Starkmar dollars. Here's the other dollars we're getting from other sources. That's what makes our revenue budget up for that program. I kind of alluded to this when I was describing how we mentioned the funding. Now, there used to be kind of a formula that would look at the number of units being pulled times an average rate, and the average rate was never perfect because the codes live together in various different states. So we've just said for the rate codes, either non-Medicaid or Medicaid eligible, we're just asking you for which code you would like. I'll flip over to this form. And in this case, these are both drop downs. The left side is non-Medicaid. If you're an existing provider, your rate sheet is the best place to look at this stuff because you're probably already billing all of these non-Medicaid codes. So you can just pull them off of there. This is where you would ask for new non-Medicaid codes, judging by the drop down. If you're a brand new provider and you're not seeing your service either detailed in the non-Medicaid code or in these Medicaid codes, I would say that's just an area to, make a note somewhere in the narrative that, we'll need some new non-Medicaid codes in order to build this program. And those are discussions we'll have after the fact. But this section now is you simply just choose from the menu of non-Medicaid or Medicaid codes to tell us what codes you're going to be utilizing in the program. Again, both are available on your rate sheets if you're an existing provider. If you're not, in your treatment, you're going to be very familiar with these codes. So you can select the ones that you're using in your program. And then the only other thing is we have some annual cost section at the bottom. And this is the only place that we're still asking for some dollars. And that's because in this section, it's some of our things that a lot of residential programs. We have some programs that have administrative costs that are being covered that are not covered under any non-Medicaid or Medicaid code. And in this section, we just need you guys to identify what codes you want to be using and how much you want of that code. So administration code is a good example. I think we have this in several programs. You might have a need for $1,000 a month in administration. So in this field, you would simply type in, okay, I need 12,000 in administration to run this program. And then that code would get billed monthly. Various other codes as well. Mostly, like I said, it's like you can see it's crisis codes and then residential type programs. This number is not in addition to the funding you've requested above. This number is included in that entire funding amount. So that $32,000 that we talked about up above includes this $12,000 in funding. And then it's, the other codes that you've selected. And then as Stephanie kind of alluded to, this section down here, this helps us kind of build rates for some of those residential programs because, we have an amount that's needed. We know how many beds there are. We know utilization rate, and we kind of work backwards and build that rate. That's kind of the only thing we lost when we took out all of the dense detail about the codes. That's all I have to say about the budget section. Like I said, it's mostly just removing things that we think we're giving people kind of pain points and making it a little harder to create that budget. I will pause for some questions here, but then I'm going to flip over to the personnel cost sheet if everyone's okay with that. Okay, I will flip over. Again, this is going to feel similar to what I just talked about in the budget. This is very familiar to folks who've done this in the past. We have taken away the two sheets. We used to have a non-treatment sheet and a treatment sheet, but then it got really confusing for folks that offered both programs. In an attempt to simplify, we kind of made things maybe a little more complicated for folks. So we've gone back to one sheet, and what we have tried to do is get rid of any information we did not need and then simplify the process on the sheet. So kind of the, I guess for lack of a better term, the statistical information on the side is all of these except education level were being asked before. And then there were a few additional questions that we used to ask that we're no longer asking in this section. The biggest change is now when you type in a total salary, that's pretty low, a total salary and a total benefits. It gives you the total cost of the position. And then what we used to do is have percentage fields, and you would say, oh, it's 25% of this position is direct and 10% is indirect, and it would do the calculation for you, which was a great tool if people knew exactly percentage-wise how, but often left folks kind of having to plug and play percentages to get to where they thought the dollar amounts worked for the program. So rather than have that percentage field anymore, these are just open fields where you can type in how much that person, generates in expense to that program, whether direct or indirect. So you don't have to try to play with percentages to get folks in correctly. You can just kind of free type in their information. You can see here, we've got the top line, we've got this staff one, and then this is how they contribute to each program. And then, as in the past, this has room for a lot of programs. We do apologize to those of you that maybe have 1, 2, or up to 5 programs. We do have some providers that have many, so we do leave a lot of space on this. And then there's a total back here at the end where you can see the variance. This is very similar to how it's always been. This just lets you know if you've kind of allocated everyone the way you wanted to. A lot of folks will use this last program, number 20, as just placeholder. Well, this person is only 50% in Starkmar programs, so you're not going to see them anywhere else in this thing. I'm going to put the other 50% in program 20 and call it other, and just for your own balancing needs. So that's the biggest change there, is we took away the percentage mechanic and then got rid of a couple categories. And I will leave, I guess, this last 5 minutes or more if necessary for any questions about these two things that I went over, or any questions in general. I think that's back to you, Stephanie.
I think so. Thanks, Chris. Appreciate it. Well, thank you, everybody, for spending some of your Monday morning here with us today. This was the last opportunity to verbally ask us any questions. So if you have questions around this RFP process, after today, you can go ahead and use that RFP questions email address to ask. And then any questions asked through that means, and the questions that came up today will be transcribed and posted onto our website. And Alexander, I've not forgotten about you. We will circle back with you. We have your email, so we'll send you an email and get you information that you need.
I appreciate that. Thank you so much.
Absolutely. So again, this session is recorded and will be uploaded probably within a week or so to our YouTube channel if you need to reference it. But thanks everybody for being here. Have a good rest of your Monday.